Morning everyone, Dr. Brian Steiner here at Wilkins Spinal Care. I'm here with another educational video for the week that we'll post on the Facebook page. Just to recap, last week we introduced what is chiropractic. As we discussed, chiropractors essentially work with the nervous system, which is our topic for the week. We call it the human lifeline, the nervous system. And the reason why we call it that is because we can't survive without a nervous system. The nervous system allows us to do everything in our life. Walk, talk, breathe, controls all the organs in our body. Essentially, chiropractors are adjusting the area that needs addressed to influence the nervous system. This week, we're going to dive into the 3 different divisions of the nervous system. Nothing extraneous, nothing that no one can understand, just something real basic, just to give you a better understanding for future down the road why you may be feeling the way that you're feeling. So I'm going to introduce those 3 different divisions of the nervous system. In order to do that, I'll introduce my spine again, just to kind of give you guys a little bit better of a visual. Just like last week, we talked about the spine, and it is the protective layer for the nervous system. Within the spine, you have that spinal cord, and you have the brain. This leads into our first division of the nervous system. This is the central nervous system. What is happening here is the brain sends messages down to the spinal cord, allowing us for human movement, allows us to feel things, and it gives us our reflexes. You know, when they tap you with the hammer, your knee jerks or your elbow jerks, whatever reflex they're doing. It allows us to have all those responses. And the same thing occurs, say you have pain or say you burn your finger. It's going to send a message up that spinal cord, and the brain's going to perceive that, allowing us to say, ow, okay? So that's what the central nervous system is. Now, if we look here, these yellow parts here, those were those spinal nerves that we were talking to. This is where we lead into the second division of the nervous system, and that is the peripheral nervous system. Once you leave the spinal cord, you are no longer in the central nervous system. You are now said to be in the peripheral nervous system. The peripheral nervous system has 2 different types of nerves. You have spinal nerves, which are these yellow nerves that I was just talking about, and you have cranial nerves that sit up into the brain. Now let's talk about the spinal nerves first. Those are allowing us for human movement. And it goes down to our arms and it goes down to our legs. So we have 2 different types of nerves within spinal nerves. You have a motor nerve and you have a sensory nerve. The motor nerves allow us to move, and the sensory nerves allow us to feel things. So those are your spinal nerves, something real basics, nothing you can't handle. Then we go to the cranial nerves. We have 12 cranial nerves that sit in the brain. One of them is not part of the peripheral nervous system, and that allows us for vision. Essentially, this is how I like to think of it with cranial nerves. They allow us for our special senses other than sight. They also allow for movements in the face, taste, things like that. I'm not going to get into that. Don't want to confuse you too much. Just something real basic. Then we go into our third division of the nervous system. That is our autonomic nervous system. That's the one that I posted on Tuesday, which was yesterday. I posted with all the organs going to the nerves. The autonomic nervous system controls all of our internal organs, our heart, our lungs, our digestive system, our urinary tract, allows us to go to the bathroom, things like that. So in this one, it gets a little confusing, the autonomic nervous system. This is all I'm going to say, though. You have 2 different divisions. You have sympathetic responses and parasympathetic responses. Here's the easiest way to explain it. They basically keep the human body in balance. For example, a sympathetic response will increase the heart rate, and a parasympathetic response will decrease the heart rate. There you go, human balance. It's just as simple as that. I'm not going to go into the whole entire anatomy of everything, because then, yes, it does get confusing, and I don't want to confuse you guys. The last thing I want to talk about is now, how do chiropractors help? Just like we talked about last week, chiropractors are influencing the nervous system. We allow that adjustment to let the body take its course, and it will show great results, essentially. So in order to do that, a chiropractor needs to do a good exam. And at this office, we have patients come in, we take a really good health history, we take a thorough examination, we take x-rays, and we make sure we give them a good treatment plan to ensure that they're going to get the best care possible. That's the biggest key to everything. Yes, we know that something's wrong with the nervous system, but we won't know exactly where the problem is unless we give you a thorough exam. A lot of chiropractors don't give the thorough exam. A lot of chiropractors, or even any type of doctor, doesn't give a good exam. But at this office, you get a very thorough exam. You get a nice report of findings because we want to make sure that patients know what is wrong with them. And we want to tell them that we'll get you better as quickly as possible. And the reason why I'm talking about this a little bit is because this is going to be our topic for the next couple weeks. I'm going to go into different phases of chiropractic care. I'm going to go into our first visit. We're going to go a little bit more into what we at Wilkins Spinal Care do. So there's not going to be much science sources because every chiropractor is different. So that's what we're going to talk about next week. Now, regarding this week's material, I do have a lot of sources for you. Go ahead and look at the Facebook post that I posted throughout the week. It'll definitely give you a better understanding of what I was talking about today. If you have any questions, please send us a Facebook message, give me a call, send us an email. I'll be happy to answer those questions for you. Have a great day, and we will see you next week for another video, and we're going to talk about, next week's going to be more about phases of chiropractic care. All right, have a good day, everyone.